The second letter of the CASCADE framework, A, stands for Agreed Point of Contact and Role in School and Further Education Colleges and Children and Young People's Mental Health Services. In order to find ways of working together more effectively to better support children and young people's mental health, identifying and having access to the appropriate person in education, health or other settings is vital. Knowing who to contact in a setting is not only time efficient, but it ensures relevant information, details, knowledge and insight regarding the young person is shared directly, effectively and appropriately. Having an agreed point of contact helps to ensure appropriate support is accessed as quickly as possible and helps to avoid instances of being passed between services or even falling between them. The CASCADE framework is intended to help partners find ways of working together more effectively to better support children and young people's mental health. It defines the gold standard for agreed point of contact as agreed and shared points of contact with all partners that are kept up to date as staff change. For strategic leaders within a local authority or clinical commissioning groups, they should consider establishing an understanding of the range of professionals, their roles and expertise within both education and health settings. The organisation of a directory should provide a succinct overview, summary of support targeted to particular groups. Within school and college settings, information on where staff in different settings can find all the named points of contact within both education and health services needs to be stored centrally and kept up to date, with all staff being able to access it. Local mental health services are encouraged to revisit and evaluate best practice in terms of sharing the knowledge of the wide variety of services on offer in the local area, as well as working to ensure that services to support mental health and neurodevelopmental needs are accessible.